Thanks, Dr. Ajay, and it's real pleasure being in this instruction course for last couple of years. And I think many of the talks have not changed, but this talk I had to totally change because many things happened in last year. So I'll be talking on some new frontiers in AI for diabetic retinopathy, and already we know that diabetic retinopathy affect millions. The prevalence of diabetes in India is less than that of US. The problem is our absolute numbers. Our absolute numbers are so high, you cannot have, so traditional screening and treatment is challenging, especially if the prevalence is pretty high, and AI is probably poised to bridge this challenge between screening and treatment. There are a couple of challenges. We have high prevalence, more absolute numbers. Though we have very nice guidelines from AIOS, VRSI, there is no structured pathway for diabetic retinopathy screening. Again, it's not feasible to have annual eye exam for everybody. We don't have so many cameras, we don't have so many people to take the photographs, and there are also a couple of AI algorithms which are inbuilt into the camera. However, these AI algorithms also have got their own limitations. So there are a couple of emerging innovations, some potential breakthroughs, and some future perspectives as far as AI is concerned. The emerging innovations are there which are already available today for use of many of us in the market, and I'll be talking about them. So in India, we have a couple of these non-mydriatic cameras which come with the AI platform which is already there, and that makes a remote diabetic retinopathy screening feasible. Many of them also have got image gradability checks, meaning that if it's a poor quality image, the AI gives a prompt that you can retake the image. So the commercially available ones like Zeiss comes with Selena, which is developed by Seri, Singapore. We have the Forest camera, which they have their own algorithm. They also use the Google ARDA AI algorithm. Remedio, very well tested in Indian settings, published. They come with their own AI algorithm. We also tried developing with Professor Tin Wong an algorithm which could predict diabetic retinopathy progression. Again, this was a multicentric study, and in Indian population, in our population-based data, we could show that we could increase the screening interval by about 32 months, and delayed detection rate was only 0.37%, meaning now you take a baseline photograph, you can say what will happen at 4 years. How these all would be translated is something which is a real challenge. The problem is that, as I told you, that we don't have so many cameras. So one of the way we thought looking at is, can we triage the patients by first looking at risk factors. So we used all the population-based studies which are published from India and developed an algorithm, machine learning algorithm, where you feed in these factors. This is a small video. So you feed in the age, gender, systolic, diastolic BP, BMI, duration of diabetes, and fasting blood sugar. That gives the output, what is the chance of having DR, and probably those who have high chance getting a retinal photograph for them may be one of the solution. Meaning that especially in our country, before screening, we need to have a pre-screening. Pre-screening could be a risk-based, risk factor-based algorithm, or probably a blood-based biomarker, any one of them, to triage patients for retinal photography. In DME and AMD both, there are now a couple of these algorithms which can quantify the fluid levels, and this is one of the work we did with Zeiss, and now the newer OCT machines are coming with these which can probably quantify all the fluid levels, which will definitely help us in treating these patients. There are a couple of potential breakthroughs which are still not there, but definitely they are something which we'll see in next few years. Definitely LLMs, the large language models, have paved its way in diabetes management. And again, this was one of the work where even we were part of it, so we could validate it in our country, where we tried using deep learning model for retinopathy and large language model to give advice. The beauty was that it matched and exceeded the primary care physician's recommendation. Even in terms of empathy, it could work pretty well. There are now many diffusion models which are coming up which can actually give a more fair diversity. Diffusion models have been used in dermatology a lot, where these are generative AI where it generates the images and now using these you can target synthetic images. You want like less age or more severe diseases, you can generate based on that so that your data is more complete and you can get a better AI algorithm. More focus is going towards foundation models. These are the models which are not small, millions and millions of thing, and there are many of the ophthalmology specific foundation model. The first one was by Dr. Pierce Keen from Moorfields. Second was from China, and now there is an effort towards a global initiative to generate ophthalmology specific foundation model. Coming to some future perspectives, people are now looking at predictive health analytics. This was one of the review article where we showed what are the various systemic diseases from retinal images people are looking at. This was a work we did with Cambridge consultants where we tried looking at can we predict neuropathy from retinal images, and we could demonstrate for the first time that AI algorithms, though in neuropathy you don't see anything on the retina, but we had shown there are functional changes in terms of sensitivity changes which happen in the retina, but deep learning algorithm can to some extent detect neuropathy from retinal images. Very recently we had published the work on anemia because we know that diabetics have more anemia, especially those who have renal diseases, and we could find out using AI algorithms detecting anemia, not only presence or absence, but also suggesting the mean hemoglobin level from retinal images. We found that the heat maps looks into peripapillary area, and we tried looking at and found that it's the vessel tortuosity and density which plays an important role, maybe a future biomarker as far as anemia is concerned. One of the things we have heard is about inflammatory mediators, and we know that you have more of these inflammatory markers. Probably the response to anti-VEGF is bit less. We developed an algorithm by which you can put the images and get all the inflammatory marker score, and it gives an inflammatory score which gives us an idea whether it would be a responder or a poor responder of anti-VEGF. So you feed in the OCT, it gives a score for all of the inflammatory markers, and we get to know whether this would be a good responder or a poor responder. More recently, we have, just last slide. More recently, we have worked on another concept of retinal age gap, and we showed it as an independent risk factor for proliferative diabetic retinopathy. It's an AI-driven biomarker. By using retinal image, you can predict the age of a person, and if there is a retinal age gap, meaning the retinal age and biological age is different, it's been shown as a marker for mortality. They are more, so we showed that it's not only mortality. Yes, mortality was one of the things. We had 4-year follow-up of these subjects, and they were more, if the retinal age gap was more, they had more chance, twice the risk of mortality over 4 years. However, we also showed that this age gap is an independent risk factor for progression to proliferative diabetic retinopathy. So to conclude, the AI is addressing a lot of key challenges in diabetic retinopathy screening and treatment. There are a lot of innovations and predictive tools which are paving way, and definitely it will be a more personalized care, and the future promises integrating it into multi-disease screening. Thank you very much. I'd like to invite all of you for the APOTS Retina meeting.